Bienvenidos a todos. Good afternoon. Welcome to the National Hispanic Council on Aging's virtual town hall, tips on keeping your mental health strong. My name is Dr. Octavio Martínez, and I'm the Executive Director of the Hogg Foundation for Mental Health and a member of NHCOA's Board of Directors. And also I am on the Biden-Harris COVID-19 Health Equity Task Force. It's my pleasure to moderate today's town hall. Due to the ongoing COVID-19 pandemic, NHCOA is continuing to develop innovative ways to engage, inform, and listen to the communities we serve. For 52 years, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. Even during the pandemic, we continue to work toward that mission. NHCOA continues its dedication to disseminate timely and accurate information, while also creating culturally and linguistically sensitive spaces in which Hispanic older adults, their families, and caregivers can come together to discuss issues impacting their lives. NHCOA also strives to connect Latino older adults with local leaders, advocates, service providers, and policymakers to work towards solutions that address their community-specific needs. This town hall is one of those spaces. Many communities face unique challenges that can make access to mental health care more difficult. Minorities suffer from a lack of appropriate support to help them receive treatment related to mental health, especially during the COVID-19 pandemic. Today, it is my pleasure to welcome a panel of experts that will highlight: 1, the status of mental health among Latinos; 2, the impacts of health inequities on mental health; and 3, the resources on mental health for families and individuals. Before we get started, let's pause to thank our sponsors, as this town hall would not be possible without their generous support. Thank you, United Healthcare, Lyft, F.A.P.A, Pharma, Lilly, Verizon, and Pfizer Foundation. Throughout the webinar, we will present a few polls for everyone to respond to, so please interact. Before we introduce our first speaker, we'd like to present our first poll question. We will provide all of you a minute to complete it. Now, what you can see there is, what are the main causes of stress for you? Please choose one of the following: financial, discrimination, or caregiving pressure. And as you can see here, quite a few of you, in fact, shows financial, followed by caregiving pressure and discrimination. So very important, right, during this time frame? Indeed. Thank you for participating in that. There'll be a few more polls to come. 1 in 4 older adults experiences some type of mental disorder, including anxiety, dementia, or depression, the latter being the most common issue among older adults, according to the Pan American Health Organization, also known as PAHO. Sadly, mental health issues have been exacerbated during the current COVID-19 pandemic. However, for the Hispanic Latino community, mental health and mental illness are often stigmatized topics, resulting in prolonged suffering in silence. The Hispanic Latino community faces unique institutional and systemic barriers that may impede access to mental health services, resulting in reduced help-seeking behaviors. Let's welcome our first speaker, Dr. Carly Zegers, an assistant professor at the University of Kansas School of Nursing and Emergency Department nurse practitioner at the Truman Medical Center. Dr. Zegers graduated with her BS in exercise science and BSN from Creighton University. She earned her PhD in F.A.P.A from the University of Nebraska Medical Center. Dr. Zegers' research interests include health literacy and policy in underserved populations, specifically advancing health literacy through improved communication and application strategies. Today, we welcome Dr. Zegers, and she will speak about the status of mental health among Latinos. Floor is yours, Dr. Segers.
Gracias, Dr. Martinez. I'm so happy to be here today. Thank you so much for this invitation. This is such an important topic, and it's something that I hope that we can talk about today and really move the mark. So I will talk today about tips on keeping your mental health strong, especially as we continue with this pandemic. I wish I could say it was over, but I don't think it is. So hold strong, we can get there. So as that warm welcome and introduction, my name is Carly Zegers. I work at the University of Kansas in the School of Nursing, but I'm the treasurer for the National Association of Hispanic Nurses. So I'm super proud to be here today and representing both organizations. Next slide, please. The next slide, please. Wonderful, thank you. I want to start today talking about the prevalence of mental health in our community. So I first want to say that because we're Hispanic does not mean that we are actually more vulnerable to mental health and anxiety symptoms. That's actually not true. We are just as likely to have it as anyone else. The problem is that we have barriers to care and other access issues that make it so much more prevalent in our community and definitely less treated. So just because you're Hispanic doesn't mean you're going to have anxiety and depression more than anyone else. It's not genetic like that. It's actually our system working against us. So I really want to start there and want you all to know that it's not because of genetics, it's because of this. And there are genetic factors to it, but we have to address the barriers and the systemic issues that are at play. So one of the big pieces is a language barrier. We know that language barriers exist across all of the healthcare industry, and it's embedded and very painful to watch as we see the number of Hispanic individuals who are providing care. There's definitely not a good number. It's not equal, and it doesn't represent our community in terms of having an equitable amount of providers who identify as Hispanic in our healthcare system. We do have laws that cover and require language services and availability, but that doesn't mean it translates. Just because the words match doesn't mean the meaning does. So that's a big piece, is that meaning and language are really important, and that you absolutely, I'm asking you to demand that you have the services you need if language is an issue, and requiring that for any family member who needs it as well. So talking about poverty and less healthcare insurance, it is very common for Hispanics to not have insurance in the United States, unfortunately, and that rate there is staggering. We're almost doubling the non-Hispanic white. And so 15.7% of Hispanics do not have insurance coverage in the United States, and that's incredibly high considering the ACA was passed a very long time ago. We need to continue to work on getting healthcare coverage, as access is a huge barrier. Next is the lack of cultural competency, so misunderstanding and misdiagnosing. As Dr. Martinez had mentioned, there is stigma associated with seeking care, and having this lack of cultural competency, meaning that your provider doesn't understand that stigma in our community. It's incredibly important that you stand up for yourself and advocate for yourself, knowing that they might not understand the stigma associated with mental health in our community. So misunderstanding, also misdiagnosing. There's staggering studies that are out saying that individuals in the Hispanic community who have a cardiac event increase the chance of having a depression or anxiety by 77%. So if you have a cardiac event as a Hispanic at any point in your life, you have a 3/4 chance of also having depression or anxiety. And that's often misdiagnosed and underdiagnosed. So we really need to make sure that we're addressing mental health along with all of our other healthcare conditions, because mental health is health. Next, one of the biggest things that I like to advocate for is legal status. Barriers to access, also because our legal status impacts our mental health because of stress, anxiety. As we saw over the last probably 4 to 5 years, the stress and anxiety associated with uncertainty and often PTSD from the reasons that people are coming here. We are not doing a good job of addressing this. And that also is covered because lack of access, lack of barrier, and because of the requirements of the healthcare system that often ask for social security numbers. So making sure that we understand that these barriers are preventing equitable access for everyone here. Next, and probably very, very seen this year, and COVID was a very devastating year, but one thing that I am appreciative of is that it exposed so many issues and just blatantly exposed issues. And one of those this year was the discrimination. We know that discrimination has been going on since the beginning of time in the United States, and it is not, Hispanics are not free from discrimination. We are at one of the top of the list. And this last year, it was very clear in the staggering rates because of COVID. So discrimination is actually a trigger for stress, anxiety, depression, and many other factors, including PTSD. And these are undertreated, and we don't talk about them. So that's really important to understand. And finally, probably one of the biggest barriers and prevalence in our community is stigma. This idea of privacy, where you do your laundry at home, right? You don't come out to the community to talk about it. We also have a fear in not wanting to have this idea that we're crazy, right? And this idea of culture that's preventing us from talking about it with each other. I do have some stats here. One of the largest studies on Hispanics and mental health, it happened quite a while ago, so it's a little bit outdated information. So this is pre-COVID, shows that about 27% of Hispanic Latinos report high levels of depression symptoms, but only 8% receive treatment of that 27%. That is incredibly low. That means only 10% of people who were diagnosed were treated, and diagnoses are not matching up. So we know that this is incredibly low. And one of the biggest issues is stigma and not talking about it. And it's also that not culturally congruent care. So making sure that we're bringing this up with your provider and making it a big issue. I also do want to point out that the Hispanic community is not homogeneous, so it's not the same. So Puerto Ricans and Cubans and Mexicans and El Salvadorians and Colombians all experience rates of healthcare and rates of mental health specifically very differently. Different studies are showing that Puerto Ricans are actually the highest level of depressive symptoms compared to like Mexican Hispanics who are a little bit lower, but the average is coming out within the 20%. Next slide, please. Now, bringing it up to 2020 and what happened last year, there's an incredible issue that's going on, and we have to get over these barriers. The COVID-19 impact on mental health is, we don't even know the end of this yet. We're not there yet. But currently, so the Kaiser Family Foundation did a study, and the average anxiety and depressive symptoms generally in the United States, not just Hispanics, but generally, went from 11% to 41% this year. And we know that it definitely disproportionately impacts us. So if you can see here with the 41%, Hispanics actually went up to 46%, and non-Hispanic Blacks went up to 48%. That is incredible. So half of our community is reporting anxiety and depression because of COVID-19, up from 27%. A lot of issues that are associated with this include increased symptoms from job loss or financial concerns, health concerns, fear of COVID, and then having to navigate this idea of what vaccinations and these next steps that we have to take. Also, increased substance abuse has been going on over the last year, and self-medication for anxiety and depression. Also, in the Hispanic community, we see that we have more essential workers, which increase our risk and have disproportionate health implications in our community. So all of those things combined together, this is an incredible topic that we need to address. So hopefully I can give you some tips. So next slide, please. So my first tip is I really want to recommend centering. It's really easy to get overwhelmed very quickly, and practicing these things on a daily basis. I work in the emergency department, and I do this on a daily basis too, so I definitely recommend it. This idea of centering, taking deep breaths, and finding yourself where you're at. Recommend using any meditation strategies, counting exercises. These are easy to Google and find, just finding online. You can do daily routines. So waking up, I wake up every morning and I take 2 minutes to myself. I set an alarm on my phone, 2 minutes to myself to just sit and be still. Finding small appreciations. That 2 minutes I do at night as well before I go to sleep. And instead of thinking all of the things that I have to work on or worry about or the stressors, I find 2 minutes of gratitude, things that I can be grateful for that happened, that I took breaths when I woke up. It could be as simple as that. And then finding things to do stress reduction. So making lists of things to do, need, utilizing your community resources. So if food is a barrier or you need transportation, knowing what you have in your community so that you're not panicking to find it once you need it. Realizing that you can only control certain things. That's also a very big deal. And then making plans and being flexible. Next slide, please. My next tip is relaxing. Finding moments of the day and letting us relax. This isn't a loud thing. I'm giving you all permission to relax a couple times a day. And even if it's 5 minutes, resting your brain and slowing the racing thoughts. My biggest form of relaxation is putting your screen down. If that's your phone or the TV or anything, put it down. Social media is driving us nuts. We have got to get rid of social media for a couple minutes of our day and stop with the stimulation. So find a good routine before bed. I say that with the social media, there are studies that show that social media increase stress, anxiety, and depression. So if we're saying we need to decrease it, we really need to put that phone away for just a little bit to try to find some more balance. Other things you can do, yoga, stretching, doing that mindful breathing, engaging with nature. We have to remember that COVID can't be caught in nature. That's what I always said during even the thick of it, is you can go outside on a walk safely and finding that safe space outside. There's also different phone apps you can use, different apps on Android or iPhone, and they're listed here for you. But using the resources you have, and you can do this with yourself. Next slide, please. Tip 3 is moving. We cannot stay sedentary. We cannot sit. I've heard a quote a few times now, and they're saying sitting is the new smoking. So we cannot stay sitting. We have to get up and start moving. So that is 150 minutes of moderate exercise per week and doing fun things. And walking counts. You don't have to run or do all these Zumba classes or whatnot, even those are super fun. But getting something in, getting movement in. You can do this alone to find your time and take your time to rest, or you can do this with someone else to engage. We are social creatures, so being able to engage with each other and our family is very important. So making it part of your schedule. Also set some goals. I think if we just sit back and think it's going to happen, it won't. We have to be intentional with our actions. Trying something new. I always recommend doing adventures because it kind of breaks up the mundaneness of things. And one of my favorite quotes is that you cannot get lost on an adventure. So I definitely recommend going out and seeing what's out there and using your community resources. Just need to move. It will help depressive symptoms and anxiety. It is studied. It is shown to reduce both of those things if you're moving consistently. Next slide, please. Okay, sleeping. This is critical. If you could star any tip of the day, sleeping is probably my number one recommendation. So there's this thing called sleep hygiene, and sleep hygiene is similarly, you take a bath every day. That's your cleanliness, body hygiene. Sleep hygiene is actually studied, and what you do is you wake up and fall asleep at the same time every day. That's step 1 for sleep hygiene. And what it does is it gives you a chance for your body to have a pattern. And when your body has patterns, it can predict what's going on and it starts centering. It's actually very healthy. It's one of the best things you can do. So yes, I set an alarm for my wake up time and my sleep time every day, including weekends. Sometimes I don't ball out on the weekends, but I try really hard, and it helps a lot with anxiety and depression, especially if you're having a hard time sleeping. If you are having a hard time sleeping, I definitely recommend reaching out to your primary care provider because there are things that we can do to help. So try for 8 hours as much as possible. Read before bed. I always like to read before bed because you can escape to a new world. That's what I like to do. So if you're stressed and anxious about what's going on at home or what's going on around you, always find a good book and escape to a different place. That's one of my best recommendations. Try out new books, and libraries are open, so go find something good. I definitely recommend putting down that screen, however. I'm a huge fan of that. Put the screens down as much as possible. I'm definitely zoomed out by the end of the day. So hopefully you can all find some reprieve from that screen. All right, and lower caffeine and avoid food before bed for your sleep hygiene. Those are the last two pieces for that. All right, next tip, please. All right, eating well and drinking water. So making good food choices. There are ways to incorporate fresh food, fruits and vegetables into every meal. That's very important. Community resources are actually very helpful for this. In Kansas City alone, I can count, it takes about 2 hands to count the amount of food pantries that actually have delivery services available too during the pandemic. And that includes fresh fruits and vegetables. But you cannot receive the food unless you reach out. So it's definitely, you got to take that upon yourself to reach out and get those resources to you. Your primary care provider office should know that. And so if you don't know where to go for those resources, definitely reach out to your primary care provider and they should be able to help you with these things. And plan out your week. That's something else that it's easy to grab and go and not think about what you're eating. So being mindful of what you're eating and putting good things in, and you get good things out. And water, it's our life source. You should be drinking quite a bit of water a day and avoiding those sugary drinks, and I call them empty liquid calories, so no sodas or pops. Definitely for a day you should be getting 64 to 100 ounces of water. That's a lot of water. You have to really think about that amount of water. It's not something you can do and sit down and just get it done. You should spread that out over the day. So, and I always like to do water alternatives because it gets really boring. So adding cucumbers or mint and doing different teas, although it's not, don't do sweetened tea, but different like sun teas and things like that to help. And that's a very important step, is drinking plenty of water. It helps with our sleep and our anxiety and depression. Our body, when we are in an anxious or depressive state, is not in homeostasis, meaning that it's not balanced. So anything we can do to get us more balanced will actually help with our mind. Next slide, please. All right, here's one of my favorite ones, which is laughing and connecting. Anxiety and depression, I think, can be stopped when we laugh. There's that time where you're really a true gut laugh and finding the people to be around that cause happiness and joy. So do things at least once a day that you know will laugh. If that's chatting with friends, some screen time is okay, and finding your favorite sitcom, and don't go all on the Netflix binge, but do 1 or 2 a day. Try to find that time to relax and laugh. Enjoy your pets or your children or your family members, nieces and nephews. I love to call my grandmother. I call her every single day and we crack up every single day, and it definitely helps with mental health. So think of the small things, being present with others and finding real true connections, reconnecting with friends. I know the pandemic has kind of put us into this situation where it's very difficult to do that, but as you get vaccinated, we can start becoming safer, and don't forget their phone calls away. Safely participate in activities, making sure that we're still using the CDC vaccine and social distancing guidelines. I've been doing Loteria every Saturday with one of my organizations, and we do it online. And so I have my boards. I still have yet to win, which is really upsetting, but I will keep going back every Saturday to try to reconnect. I usually eat my Cheerios. I use Cheerios. I don't like Fruit Loops. I usually eat my Cheerios before I get to the end of the game anyway, because I never win. So doing things to connect is important. And then my last and final tip for the day, next slide, please, is reaching out. So this is my big piece. This is what I really want to stress and send home with all of you, is take this upon yourself to reach out, okay? You should have an annual appointment with your primary care provider. That is very good practice, minimum to have once a year, in order to make sure that you have good connection with them, and bring up your mental health. It is, if you do not talk about it, it cannot get addressed and we cannot treat it. You have to bring this up. There's also counseling services available, both telemedicine, like we can do it over chat now, we can do it in an app, we can do it in the office. Making sure that we're reaching out for our community resources. So with or without insurance, a lot of this is available because it is such a problem. And one thing I do want you to know, and this is coming from healthcare front lines, I'm telling you this, if anyone says otherwise, get a hold of me, because they're wrong. You are not a burden. So do the smallest change to help yourself and to help others, and bring these things up during your appointments. For others, if you notice that someone's not doing well, check on each other. It's time to really start lifting up our community and holding us together and elevating each other. Set times to make small connections and share your resources as you find them. We should start sharing these within our families. I know I bring them to my family all the time, and I think my mom rolls her eyes every time, but she uses them, and I know that it helps. It helps her, it helps my grandmother, it helps my family. When we're all able to be there for each other, it makes an incredible impact. Next slide, please. This is my mental health resource list that I go through. So we have quite a few options. There's actually specific things for our Hispanic community, which I really appreciate. These should be available to you, and I know we'll review some more in the future as well. Next slide, please. And I hope you all have a great day. This is probably one of the happiest dogs I've ever seen. And one of my mentors, my favorite quote from my mentor is, "I hope that you're as happy as a bird with a French fry." And that's my presentation.
Oh, I like that. Okay, thank you. You made me laugh. Hey, there you go. Thank you, Dr. Zegers, for that wonderful presentation. I think there was many things that you highlighted that we can definitely take away, and I loved how practical some of your tips were. I want to remind all our attendees that if you have any questions or comments for our presenters, please type them in the chat box, and we will address many of your questions as possible during our question and answer session. Now, before presenting the next panelist, we want to present our next poll. Was your mental health impacted by the pandemic? So please answer yes or no. And overwhelmingly, the majority of us were impacted by the pandemic. However, there are a few no's. That's good to hear. It would be interesting actually to chat and find out why the pandemic did not affect you specifically. Moving along though, the COVID-19 pandemic has brought social and racial injustice and inequity to the forefront of our country's consciousness. And those were mentioned by Dr. Zeger. And it also has highlighted how these inequities are prevalent in healthcare. It has illustrated that health equity is unfortunately still not a reality here in the United States. COVID-19 has disproportionately affected many racial and ethnic minority groups, such as communities of color, putting them more at risk of getting sick and dying from COVID-19. Some examples affecting health equity in communities of color include discrimination leading to chronic and toxic stress, social and economic factors placing groups at increased risk for COVID-19. Healthcare access and use were difficult. Occupational hazards were present, and workplace safety, and among other factors, were also issues that had to be dealt with. Mental illness is closely associated with many of these inequities, which people living with mental health problems, including severe mental illness, are particularly vulnerable to experiencing and more susceptible to amid the pandemic. So today I will talk about the impact of inequities on mental health. And with that, my slides will be coming up shortly. Next slide, please. And next slide. So as you notice that one, it says pre-COVID-19 environment. So what I want to start with is I want to contextualize where we were before we moved in. And as you remember, we just recalled just a minute ago, how Dr. Zegers pointed out that in what COVID-19 did was really sort of peel that onion, and now more of us are much more aware of the disparities and inequities that already existed. But one of the things that is really important that I think has to contextualize why we, Hispanic and Latinos, but also other minorities and communities of color, were affected so much by this pandemic, is that we've been having this fight for the middle class dream. Take a look here at this slide where the median white family has 22 times more wealth than the median Latino family. So we're way behind the curve when it comes to trying to achieve middle class status. Now, there are a lot of Hispanic and Latinos who have achieved middle class status and even upper middle class status, absolutely. But in general, we have not as a group. Next slide, please. One of the biggest ways to achieve middle class status, and which is very important because it's where the greatest amount of wealth for the majority of Americans lies, is in home ownership. And as you can see here in this slide, this is data from 1994 to 2019, 25 years time span, that shows that in fact, Hispanic and Latinos, we have made a little bit of progress, but still we haven't even achieved 50% ownership rate within the Hispanic Latino community here in the United States. We're at 47.5%. And unfortunately, as you can see, for some other cohorts or groups, American Indian, Alaska Natives, they actually lost a little ground, and it's been pretty flat for our non-Hispanic Black populations. Whites, on the other hand, non-Hispanic whites have actually made a little bit of gains. So have we made some progress at Hispanic Latinos? I mean, yes, but it's just not enough really. And so a great percentage of us, over half, continue still not to have our own homes. And that impacts the ability to gain wealth within a family. Not income, but wealth, because that's where financial resilience lies, in the ability to pass that on to the next generation. Next slide, please. And so poverty is one area that continues to affect the Hispanic Latino community. And I think one of the great ways to measure that is how many of our kids are in poverty. As you can see here, it is way too much. 17% of children in the US, that's all kiddos, right? 12 million children in this country live in poverty as of 2019. And yet we are the wealthiest country on the planet. That is just, to me, is unacceptable. And as you can see here, I highlighted that all the children, Hispanic and Latino children, from a gross number, represent the biggest number of kiddos that unfortunately are living in poverty situations. 4.3 million. Now, we don't represent the largest percentage. Unfortunately, that is actually taken up by our Black and African American children, who represent 31% of all of the Black children in the US are in poverty. But those are this percentages, they are important to keep track of, but there are way too many children of every race and nationality and ethnicity that are living in poverty. But we are the largest. We need to continue to make progress in this respect, because as we well know, our children are our future. Next slide, please. Next slide. So let's talk a little bit about mental health, just like Dr. Zegers did. Here are some key factors that were pre-COVID-19 that are super important. Number one is, and she mentioned this, culture is still an extremely important part of who we are as an individual, as a family, as a community, even as a country. And it does and it is important when it comes to our health and our mental health. So our cultural attitudes, our health beliefs, how we actually implement our health practices are key and important. Unfortunately, when it comes to Black, Latino, Indigenous, and populations of color, another term that's being used is BIOPEC, we face many challenges around mental illness, such as higher burdens of morbidity, which is illness, and also receiving lower services, and especially even evidence-based treatments. But here's the rub. When we do access these services and do get to the evidence-based treatments, unfortunately, they are at poorer quality. So there is an access issue, and then there is actually an implementation issue at the same time. And so it's almost like a double problem that we're having there, and we need to be able to address that as we go forward. The workforce is really a rate limiting factor when it comes to delivery of care in this country. And unfortunately, we still do not have concordance. What I mean by that is that we still don't have enough representation of each of our communities at that level who are providers. So there's not enough Hispanic and Latino psychiatrists and psychologists, or even social workers, psychiatric nurses, and the list goes on and on. We still need to do a great amount of work. As you can see there, we are 18.5% of the population, and yet we can't even make 7% of the psychiatrists in this country are being Hispanic and Latino. So that means that cultural linguistic competency skills are extremely important, not only for the delivery of care, but also that our providers have those skill sets to be able to provide culturally linguistically competent care to all communities. The current science base, even though there's progress being made and it's now top of mind, thank goodness, in the pandemic, but still, historically, all of the treatments and interventions that are designed in the studies that we hear about that need to be done before an intervention or even a vaccine is delivered has to include the population so that it actually is able to be delivered and we have the knowledge. As an example, during this pandemic, we heard about, that initially, now they are being included. For example, pregnant women weren't included in the first cohorts of the vaccines that were being studied. Also children, right? So we're doing that now so that we can actually expand who can get vaccinated. But the same was also true of communities of color. There weren't enough Hispanic and Latinos in the initial studies, not enough Blacks in the initial studies, not enough Native Americans, and we know better. We need to ensure that we are equitably, this is where the equitable part really comes into play. We need to think about and ensure that we are not creating any unintended consequences of disparities or increasing disparities or creating new ones, when in fact we can actually prevent and actually be equitable in the delivery, in the development and then the delivery of the interventions and the treatments that are so woefully needed by all of us. The lack of appropriate linguistic ability, as Dr. Zegers pointed out, is top of mind in our emergency rooms, in our ambulatory settings, in our hospital settings, in setting up vaccination sites. Did we have translators on site? Did we have people that were bilingual, bicultural? The answer was not initially, and it was no. We are doing better, but there is much that we can still improve upon. And so because of that, many racial and ethnic minorities are wary of accessing care because of prior experiences, because of historical misdiagnosis, just like Dr. Zegers pointed out, because of inadequate treatment, as I have pointed out, especially mental health care, and also because of lack of cultural understanding. And of course, as also mentioned by Dr. Zegers, is we're not monolithic. So we need to be, community-centered and individually centered as well when we deliver this type of care, because, Puerto Rican versus, Mexicano, Colombiano, there are nuances. We're not cookie cutter. But also what's important is also the level of acculturation. We have here Hispanic Latinos that are third, fourth, fifth, seventh generation Americans, and yet we have others that are new to the United States, and so they're new citizens and they're here, and so the level has to be adjusted accordingly to be able to deliver good, solid care, because all of us deserve equitable care, which is to say, care that is available to all of us to have the best health outcomes possible. Next slide. Next slide, please. So let's go to COVID-19. So the pandemic, as has already been stated, has revealed deep-seated inequities, unfortunately, in our healthcare for the communities of color, and it amplified the social and economic factors that contribute to poor health outcomes. And as you can see there's a whole litany of things of how it has impacted us. And it's already been mentioned by Dr. Zegers, the fact that communities of color, but especially Hispanic and Latinos, were the largest that unfortunately are uninsured when you take a look at it as a group. And so that has an impact when it comes to access. Substantially lower access to mental health and substance use treatment services is one of the results. Also, we're more likely to be essential workers. A lower percentages are working from home. So that also factors that are key to the pandemic that impacted our population. And also we're more likely to live in multi-generational low income or public housing. So think about it. If you're an essential worker, which means you had to work because you couldn't work from home because of your job, right? And so then say you were, which also placed you at higher risk because also what ended up happening, there was lower PPE, which is personal protective equipment, available for Hispanic, Latinos, and other populations of color. So that puts you at greater risk. Then it was identified you were in contact with the virus. And so we had to follow protocol and you were to then go and sequester at home. But if you're living in a multi-generational home, how are you going to be able to do that without actually exposing the rest of your family? So there, as you can see there, it builds upon itself and increases the risk factor, not only for you, but also those around you that you care about, your family and your neighbors, because we didn't take into consideration how, in fact, we should roll this out to ensure that everyone was safe. And so also, even in fact, as you can see in the last bullet, about also the utilization of public transportation by many individuals, especially Hispanic and Latinos and other communities of color, depending on the setting or in our country and more in the metro areas. Next slide, please. And so what was the result? Initially, especially in 2020 and early 2021, before the vaccines rolled out. Well, unfortunately, a greater percentage of us were getting exposed to the virus and coming down with it. That's morbidity, which is illness. And then the result was, because at the time we were also developing and having difficulty equitably delivering the interventions and the care that were needed. And so that resulted, unfortunately, in increased mortality. And so Latinos died at 2.5 times the rate of whites in reference to COVID-19. Next slide. But here's another thing we need to keep in mind, that there was another sort of epidemic happening in the United States because once COVID-19 came on board. And actually, there's other factors you can say. And so I want to bring the concept for all of those that are here to think about syndemic. And as you can see here, a syndemic is when multiple variables come together that are impacting the community. And so in a syndemic, the interactions of diseases or other health problems, for something like structural racism, discrimination, and stigma, those types of things commonly arises because of adverse social conditions, which we have been talking about during this webinar. And that puts socially devalued groups at heightened risk. And so in fact, Hispanic and Latino, Blacks, and other populations of color, we have been dealing with a syndemic as well. Mental health inequities, along with COVID-19 and its impact, and structural racism. And when it all comes together, as you can see in this Venn diagram, it's really that center that is impacting quite a few folks and causing undue and unnecessary trauma. Next slide, please. And let me highlight the importance of culture. We've already mentioned that, but I do want to emphasize cultural linguistic competency has been around in a long time, and yet we still haven't achieved cultural linguistic competency skill sets in the 21st century workforce. We need to continue to ensure that we are teaching and training and utilizing and implementing cultural linguistic competency skills. This is a lifelong learning for those of us that are in the healthcare field as providers. Why? Because we need to address and ensure that we are minimizing, if not eliminating, health disparities. What's a health disparity? Well, it's a higher burden of illness, injury, disability, or mortality, which is death, experienced by one group relative to another. And the baseline group here is non-Hispanic whites. And that because we want to ensure that we are actually delivering good quality, equitable care in our country. Next slide, please. So I want to end with this, because this I think brings to bear, especially now in 2021, because the vaccines are rolling out, right? And we've vaccinated a great deal of our folks, but there's still vaccines that individuals that need to be vaccinated. So there was this term vaccine hesitancy that came out, which it did not sit with me well, because I think it's really about vaccine equity. So what I mean by that, because I think with vaccine hesitancy, once again, we're putting the onus on the individual instead of looking at what are the systemic factors that are impacting the individual's decision to be able to get vaccinated. And so vaccine hesitancy, it fails to capture those systemic natures of the issue. And we've talked about this, the access that one needs to, you can't create access. That's a systems issue. So and also lack of personal transportation, the inflexible vaccination schedules that existed initially. We've been addressing those since January of this year, and they become better. Healthcare system has failed to engender trust. Did we use trusted messengers? Did we worry about vaccine safety and answer the questions that our community needed to hear to be able to make an informed decision? And once again, the lack of cultural linguistic consistency and competency was missing. Knowing that, as we mentioned before, we're not monolithic as a group, and no group actually is. And so one size doesn't fit all, but we should have had a multimodal approach. And also, initially, online registration was the way to go. But if you're an essential worker and you're working from 8 to 5 or whatever your shift is, and that's the time that you have to be able to register, well, that's not going to work. Not to mention that computer access isn't available to everyone yet. And many of the vaccine websites weren't amenable to mobile use. And so if you had your smartphone or your cell phone, you were trying to log on, it wasn't working out initially as you had hoped that it would. And yet we're a high-tech, intelligent country. We should have seen this ahead of time. Next slide, please. Solutions. So what we need to do is meet people where they are. We need to be community and person-centered, recognizing those structural drivers that we've been mentioning, Dr. Zegers and I, utilizing demographic information. We have tons of demographic information, and we know where we need to actually put resources and put more attention, even though we also need to work on actually in gathering that data and doing it equitably as well. And that also is extremely important. Why didn't we deploy mobile vaccination units from the very beginning? We should have, knowing that there are folks that are homebound. How about individuals that are in homeless categories, difficult to access geographic areas? We know where these areas were. That's what we should have been thinking about. Partnering with our community clinics, community-based organizations. Communities know best what they need and how to get it done. And it was utilizing grassroots community-based outreach efforts that already existed, and actually partnering with them would have been extremely smart thing to do. And I've already mentioned about the scheduling about after hours on the weekends would have been something that would have been very beneficial to all communities, but especially the Hispanic and Latino community. Next slide, please. And so communications outreach also was very important. I mentioned about ensuring trusted messengers. Were we talking to the doctors that our communities are very comfortable and who they trust their voice? What about our promotoras, our community health workers? We need to utilize everyone. Hands on deck was the time. Bring everyone to the table and let us all work on this together. Ensuring that we're addressing any type of safety issues or concerns that individuals have, and be non-judgmental, not pejorative, and not to discriminate against any one group, but truly taking their questions respectfully and at face value. And provide that vaccine information, as we mentioned, in multiple languages, as well as ensuring we had translators on hand. We could have done that. We could have had people at the vaccination sites, regardless if it was a mass vac site or maybe more of a community-centered vaccination site. And using all types of communication that people use. Not everyone listens to the radio, not everyone listens to the television, not everyone uses social media, but enough of us use all of those so we can use a multimodal approach, and ensuring that we're also bringing folks together for public information sessions. And I've already mentioned about peer-to-peer education, sort of like promotoras and community health workers. Next slide, please. Why? Because equity is so important, which means that everyone should have a fair and just opportunity to be as healthy as possible. And this goes across the board for all races, ethnicities, everyone that lives in the US. When we don't do this, then certain groups are left behind. And that is what we are identifying today. No one should be left behind. Next slide, please. So thank you. And we're on to our third poll. So before presenting our next panelist, and I'm looking forward to hearing from our next panelist, we want to have you answer this question. How would you like to receive information to address your mental health needs? Webinars, trainings, hotline, all the above. Those are your choices. And our results are in. All of the above takes the lead. I'm not surprised. I think you are correct about that. And webinars seems to be an important one. And hotline didn't do quite as well. But I'm sure if you folks could maybe find that to be of use. But we should be using all modalities. I totally agree with that. Well, the COVID-19 pandemic has had a major effect on our lives. We've been discussing that already, and you know it because you've been living it. Many of us are facing challenges that can be stressful and overwhelming, causing strong emotions in adults and children alike. However, promoting good mental health involves creating living conditions and environments that support positive mental states and allow people to adopt and maintain healthy lifestyles. So let's hear from our next speaker, Ms. Elise Padilla, an advocate for breaking down the barriers and stigma around mental health and substance use issues. Professionally, Elise aids in the creation of supportive mental health programs with the National Alliance on Mental Illness and works with peer-run organizations as a nonprofit consultant and owner of Rebel Leadership Group, LLC. Personally, she invests in the development of minority leadership in her community and strengthening behavioral health services in New Mexico. As a peer in recovery, she believes that actions speak louder than words, and her actions are focused on providing guidance for present and future generations, especially through her 2 young daughters, who she encourages to speak their truth and break down barriers for themselves and for others. Ms. Padilla will speak on resources of mental health for families and individuals. This is such a great, I think, presentation we're about to hear. So Ms. Padilla, the floor is yours.
Thank you so much, Dr. Martinez. I appreciate it so much. And thank you all for having me here today. I'm here to discuss mental health resources for the Hispanic Latino community. And I'd really like to begin with an introduction of NAMI's Compartiendo Esperanza. So if we can go to the next slide. So being a senior manager with the National Alliance on Mental Illness, I really appreciate the opportunities that NAMI has created with their Justice, Equity, Diversity, and Inclusion team to develop Compartiendo Esperanza and sharing hope for individuals and families from the Hispanic and Latino community. Compartiendo Esperanza is a bilingual 90-minute presentation that can help increase mental health awareness in Latino communities by sharing the presenters' journeys to recovery and how and where to find help. Compartiendo Esperanza also addresses a number of really important topics, such as the signs and symptoms of anxiety disorders, bipolar disorder, schizophrenia and depression, how to talk about mental health and decrease stigma, an overview of recovery and how it's possible, and the types of mental health services and supports available, including NAMI education and support groups. This program has been a long time in development because NAMI was so careful to make sure about the cultural competence and understanding, the humility that goes into understanding the needs of the Latino Hispanic population. And myself, being someone with lived experience and having to work with family, friends, and with my own mental wellness to understand that, as Dr. Zegers and everybody has mentioned today, this is no longer a culture of silence. We're here to create change in those that come after us and in ourselves so that we can find mental wellness in all of the ways possible. So if you're interested in more information about Compartiendo Esperanza, please visit nami.org, so it's NAMI.org, and you can find some amazing opportunities to become a part of this community. And the beauty of this is that we can do it virtually, but also within our state organizations and local affiliates. So within this information, there is a link to a YouTube video, but if you go onto the NAMI website, you'll see that you can view the trailers for Compartiendo Esperanza. You can find local resources, as well as any of the books and materials that they have available. Next slide, please. Great. So some other great resources that I have tie into some of the presentations earlier today. So this leads me to be very confident that you all will find something that can reach you all in the way that you need. So some other resources that I have that are being discussed are in these slides. And if you're provided with the slide deck afterwards, each of these is a link to the website. But if it's not accessible in any way, please feel free to reach out to me and I can get this information to you, because I think it's extremely important that we access resources that are relevant to us where we are. So the first one I want to discuss is the SAMHSA Mental Health Technology and Transfer Center. This is out of Puerto Rico. And the National Hispanic Latino Mental Health Technology and Transfer Center serves as a key subject matter expert and resource for workforce and community development across the United States and its territories to ensure the high quality and effective mental health treatment and recovery support services, as well as evidence-based and promising practices that are available to help reduce health disparities that Dr. Martinez discussed a little bit ago among Hispanics and Latinos experiencing mental health disorders, and in particular those with serious mental illness. There's also the National Latino Behavioral Health Association. Very close to my heart, I was a Josie Turabo Romero Scholarship recipient with the National Latino Behavioral Health Association in 2017, which helped me in gaining my master's degree in nonprofit development for recovery support services. The National Latino Behavioral Health Association was established to fill a need for a unified national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and adequately trained personnel. So NHCOA provides recovery-based resources as well as, like I mentioned, the annual scholarship program that supports Hispanic and Latino students in pursuing careers in behavioral health. Please, I really highly suggest that you look into this resource for any students that you happen to know who are going into the behavioral health field, because as Dr. Martínez mentioned earlier, we don't have enough behavioral health professionals that understand the cultural implications of the Latino population, of the communities that we live in. And so NHCOA and the JTR Scholarship are an amazing resource to help students pursue their education to become these much needed behavioral health workers in our communities. There's also the American Society of Hispanic Psychiatry, and they promote the research, education, advocacy, and support for those in the Hispanic community. And they also offer a Find a Physician feature on their website so individuals can search out mental health providers. There is also a Therapy for Latinos, and it's a database of therapists who either identify as being Latino or Latinx or have worked closely with and understand the unique needs of the community. The website is also offered in Spanish, which is a great resource. We also have Mental Health America's resources for Latino and Hispanic communities. So the M.P.H website provides general mental health Spanish-speaking resources, including a list of Spanish language materials and Spanish language screening tools. Also, there is the Help Advisor. So this is the Hispanic American Mental Health Disparities Report, and this touches on a lot of what we've already discussed today, but I love to have this information at hand anytime that I am talking to individuals and just for my own information. So I suggest you look at this report, which found that 3.8 million Hispanic Americans aren't getting the mental health care services they need, and it also further explores the issues, including expert public health analysis and local Spanish language resources to help serve the community. Lastly, there is a Psychology Today link. If you look up Psychology Today for a therapist search, they have an online directory of Hispanic and Latino therapists and support groups that you can reach via telehealth and locally so that you can see someone in person. Next slide, please. So addressing barriers to care. So in sharing this information on resources for mental health services, I think it's also important to discuss addressing barriers to care and accessing culturally and linguistically competent care. So the National Treatment Referral Helpline can help in dealing with financial issues that may prevent someone from getting the help that they need. So you can contact local health or mental health clinics or your local government to see what services an individual qualifies for. You can find contact information online at findtreatment.samhsa.gov. or by calling the National Treatment Referral Helpline at 800-662-HELP or 4357. And if an individual or their family member does not speak English or is not comfortably fluent, they have the right to receive language access services at institutions that receive funding from the federal government, as well as the right to request a trained interpreter and to receive forms or information in their preferred language. Lastly, if someone doesn't have legal documentation, we highly suggest that they seek out clinics and resources that care for all members of the community. There are many community-based organizations that provide services regardless of legal status. Next slide, please. All right, so talking about the resources offered in mental health specifically for the Latino and Hispanic population, I think it's really important that we discuss how we reach out to these resources and what we can expect from our providers and those that we are reaching out to meet our needs. So in meeting with a provider, it can be really helpful to ask questions to get a sense of their level of cultural awareness. Providers expect and welcome questions from their patients or clients since this really helps them better understand what's important in their treatment. So I've provided some sample questions that we can ask when accessing treatment and trying to find a provider that's going to fit our needs. So we can ask, have you treated other Latino or Hispanic people? Have you received training in cultural competence around Latino and Hispanic mental health? How do you see our cultural backgrounds influencing our communication and my treatment? This is really important to me individually in accessing my mental health care. I do ask questions like this of the individuals that I seek resources and support from, because I've noticed there is a very different dynamic that goes on not just in being Hispanic or Latina, but also in being a mother, the roles and the expectations that we have in our communities, in ourselves. And In my experience, we were taught, the sin vergüenza, let's not, do our laundry in front of other people, but also that you are strong enough. You're strong, you can handle it, and don't let them see the chinks in your armor. So it's that martyr syndrome that, I was very much taught early on, that you can get through this and just be happy for the family. If you can be happy for your family will be happy for you. And to putting all those other things aside. So when I speak to providers, I want to make sure that they understand the intersectionality of all of these things and how they impact me, my physical health, my mental health, and my expectations for my care. Next slide, please. All right, so whether you seek help from a primary care doctor or a mental health professional, you should finish your sessions with health professionals feeling heard and respected. So again, I love how they mentioned before that you are not a burden. This is something that was very difficult for me as an individual to overcome because I wasn't good at asking for help, but you better believe I could give help and support and healing to all of those around me. And so to hear early on that I wasn't a burden in my mental wellness journey really helped me advocate for myself, for my family, and now for my daughters. And so making sure that we are heard in the interactions that we have in accessing our mental wellness. So ask yourself these things after reaching out to a resource or meeting a new provider. Ask, did I feel heard? Did I feel my provider understood my concerns? Did my provider communicate effectively with me? Is my provider willing to integrate my beliefs, practices, identity, and cultural background into my treatment plan? For me, again, this is a big one because I have a very holistic idea of my whole health. It's going to incorporate my faith. It's going to incorporate some remedios, some natural things that I use here, my rosemary, my sage, my herbs, all of those things, but I want to tie them into my primary care plan and to the work that I do because I know that having this well-rounded belief and a practitioner who understands my integrated beliefs is going to be the best plan of action for me. You can ask, did I feel like I was treated with respect and dignity? And do I feel like my provider understands and relates well with me? Next slide, please. Great. So again, mentioned, if the preferred language is not English, it's important for us to let office staff know when scheduling an appointment. This allows them to schedule an interpreter before the visit. And when using an interpreter, your mental health provider should make sure that the interactions with the interpreter are going to be the best way for you to articulate your needs to your providers. So if someone believes that language barriers are negatively affecting their mental health treatment, they should consider bringing it up to the provider. They may be able to schedule more frequent or longer appointments to allow adequate time for the use of an interpreter. The relationship and communication between a person and their mental health provider is a key aspect of treatment. So it's very important for a person to feel that their identity is understood by their provider to receive the best possible support and care. I really truly hope that you're able to access these resources and they're helpful to you. But first and foremost, just always remember that reaching out is the first step. So thank you so much for having me here today.
All right, that was excellent. Ms. Padilla, thank you so much for your presentation. You and Dr. Zegers really covered a lot of ground. You really highlighted some such important issues. Love the two perspectives, as well as the fact that you had some really practical, tips, solutions. And I love the fact, Ms. Padilla, you're saying you need to ask your provider. We, as a community, we have a tendency to be very respectful and not push our doctors. But it's okay, guys. We can do that. We can do what Ms. Padilla is asking us to do. So let's do that. So I do want to remind all attendees, by all means, please put more questions in the chat box. And we are now going to begin our question and answer session for these wonderful, two wonderful providers and subject matter experts. And we have already some really good questions. So let me begin for both for Dr. Zegers and Ms. Padilla. What can I do? This is the question. What can I do if an older adult refuses to receive mental health care? And I really love both of you to answer that because you're coming from different perspectives, and I think it might help the individual who's asked this question really, take away something from the discussion today. So let's start with Dr. Zegers.
Yeah, so that's a very good question, and it's hard. That's a hard question. I always go back to safety. If that person is not safe, you have to get them safe. Now, if they are safe and you want to discuss mental health resources, you don't have to call them mental health resources. We can talk about it. We can talk about, let's reduce stress. Let's talk about how we can ease burdens, or what we can do together, or how we can do these things together. I think going at mental health as a partnered experience where we're doing this together has been very helpful. I know I struggle with that in my family as well, and going about it as it's a group thing, or we're moving together, or trying some of these alternative methods, and having those moments where you can keep putting little seeds of information and saying, this is health. Mental health is health, or anxiety doesn't make you crazy. It's this, these aren't these little things. So always keeping those little tiny tips and tricks involved really helps, I think, and slowly over time. But yeah, just make sure they're safe. If they're not safe, get them safe first. And then next steps are try to keep being there for them and not judging them, and doing it together.
Ms. Padilla, how about your insights?
That's wonderfully said. Making sure that safety comes first and foremost. I am a certified peer support worker, so I believe in walking the journey along with somebody. And I found that has been extremely beneficial in managing the mental health of my family and those around me, because I have been experienced with this. In a beautiful way, my family does live here on my property with me. So my parents are in the casita next door. I have grandparents about 3 miles away. So I am just engulfed in family some days. It's like they're here. But what I had to learn is, having family so close, if they weren't working on their mental health, then I noticed that it was adversely affecting mine. And so as hard as I wanted to work every day, it was difficult if I didn't have those around me who were doing the same. So in the idea of peer support, I started to model behaviors, because nobody wanted to talk about it. I had lost family members to mental health issues and concerns, and the problems that come with that. So nobody wanted to talk about it. Nobody wanted to talk about the self-medication of substance uses. And so I used my experience in being a mental health professional, as well as peer support, and then just my wellness journey, to model behaviors for them. So I would use language about accessing therapists, counselors, medications, depression, anxiety. This is what I'm feeling. This is what I'm going through, to normalize the language first and foremost. And then, with exactly as Dr. Zager said, no judgment, I started talking very openly about my mental health journey. And I explained that I was seeing a counselor. I love going to see my counselor, because it's like I go and drop off all my baggage at her office, and I leave it at her door, and I come home refreshed. And so I would just open up the conversation, and exactly as you said, planting the seeds. I truly believe in planting the seeds to make change, and just modeling the behavior and showing them that I was accessing services, that I had no shame around talking about my mental health concerns and my needs. Slowly but surely, we normalized that language and the behaviors associated with the change. And now, you wouldn't believe, but those are the conversations around our dining room table. My dad and my husband, they all see counselors and therapists, which never in my lifetime would I thought that I would see. But I know that it was up to me to break down these generational traumas and curses, and to help them, and to show them that it was okay for me to do it, and they wanted the best for me. And then for me to advocate that, well, I want the best for you. So let's walk on this journey together in a very safe and productive way.
That is both of you super powerful. Ms. Padilla, you are actually walking the walk, as they say, and talking the talk. That is just fabulous. Great for our audience to hear and know that modeling, and it took a little bit of time, it sounds like, to create that trust, that environment, to be able to share and understand that stigma robs us of our resilience, because we are very resilient people. But stigma is something we need to keep in mind. It will take that away from you, and it doesn't have to be that case. Listen to these subject matter experts. They are giving us some extremely important pointers. Okay, next question. Here's another one. What is a unique challenge that Latino older adults face regarding mental health, from your perspective? I'm going to start this time with Ms. Padilla, and then we'll have Dr. Zegers weigh in, because both of you are just truly are throwing pearls left and right here. So Please, Ms. Padilla.
Absolutely. So something that we've seen that impacts the older generation, I would say in personal experience and working in the population that I do, it can be one of two things, either resistance to accessing mental health services or over-reliance on physicians and doctors in Western medicine. I have both of those kind of branches in my family where there are some who, no, I don't like going because they always find something wrong. And so they just avoid it completely. But then I have other family that prescribes to every single thing that any type of professional mental health primary care will tell them. And that can get really dicey because there are medications that can interact that they're not sharing, they're not communicating effectively with their practitioners and with their providers. And so it's about, again, education and advocacy, because this isn't discussed openly. And so we don't know the right path. We don't know what medications are, what we should be taking, that there are side effects associated with them. And then there's that silence that we feel of, I don't want to ask because I don't want to be a bother. I'm just going to hurry. I'm going to take all the medications they tell me and I'll move on. I'll be fine. I'll figure it out on my own. And so seeing the different dynamics that this happens, and I've seen it very close to home. And so educating, advocating, and giving resources and opportunities that are culturally and linguistically relevant.
Very good. Dr. Zegers?
Yeah, so great points. And I think something that I'd like to add on is that this is not a broken arm. Mental health is a lifelong thing and it changes. And so as we're looking, and the science is growing too, which is great. So anxiety and depression are actually like a scale, and it comes and goes and it gets worse and can get better. And as people age or as things change, so does your mental health, and so does how anxiety and depression present itself and what it does. So what that means is that we have to have a good relationship with our providers, and we have to be honest and open. And so talking about this every chance we get and just touching base and saying, this is what I'm doing, any recommendations or where I'm at, or this doesn't seem to be working. Being very comfortable with saying, I'm not happy with where I'm at right now. It's very hard to say that because you might not know what happiness is, right? Like you don't know what you could have until you get there sometimes. And something that I find that's really hard is this isn't a quick fix and it's not a quick answer. And so giving some room for grace and being patient with the provider and patient with yourself and with those around you is really important. And knowing that getting it right the first time is almost unheard of and it's never the same forever. And so in giving that a little bit of time for things to work and for what you're doing to work is important. And I know that there's a lot of unknowns with medications, especially like one of the examples that I work with. You don't have to be on the medications for forever. In fact, some people are on medications for a few months of the year because of depressive symptoms from like seasonal changes. And so having these conversations and being able to just talk about it openly with the provider and getting a game plan that works best for you is the best thing you can do. And again, remember that giving yourself grace and knowing that things are going to change. When you're sick, things change. When you're well, things are better and change. And over time, things change. So just know that it's never going to be stagnant. Like I said, this is not a broken arm. It can't just be fixed. It doesn't work like that. So those are my tips, I think.
Excellent. One thing I'm going to bring up, something you mentioned during your presentation, Dr. Zegers, what I think also is important to weigh in here is that mind-body connection. So as you point out, cardiac events put us at greater risk of having depressive episodes. But the other thing in general, as we age, we have, unfortunately, usually chronic illnesses, right? So there may be cardiac illness, like maybe you've had a heart attack, or maybe you've had a stroke, but also a great percentage of our population is with diabetes, which also puts you at increases for depression and anxiety, as well as we know also folks are dealing with arthritis, all different types, maybe rheumatoid versus osteoarthritis. But we know that the more chronic illnesses you have, it does also increase your risk for depression and other mental health issues. And so there's this strong connection of why what our subject matter experts here are telling us, why it's so important to stay connected, to be in tune with your provider, ensuring that they're providing good cultural linguistic care. And I love what also Ms. Padilla brought out is that a great resource out there can be actually a peer, someone that you can rely on that can help navigate through this complicated system we've created here in this country. And that's something we don't talk enough about, is how complicated the healthcare system really is. And so the older we become, it's challenging for us as young, and it gets even more challenging as we get older to deal with all of these different nuances and aspects of our healthcare system. Let's go on to the next question that we have here. And this one I'll throw out to the both of you. What have we learned about mental health care during the pandemic? So what is it that you guys maybe have seen that you've learned about mental health care during this pandemic?
I can start. So something that I learned is how important it is that we prepare ourselves, that we have wellness recovery action plans, we have understandings of resources available to us, because the pandemic came out of nowhere, we weren't prepared. And so being able to check in with ourselves and know when we're not okay, to realize that it's okay to not be okay, and to realize that we're not alone in this. And so the ability to learn our social support systems and to relearn what wellness is and our locus of control, our ability to access the wellness and care that we need. But also I think it's important to see the intersectionality and how a lot of the population has realized that we are touched by mental illness. All of us in some way, whether it's through our own lived experience or through vicarious experience, through family members, through friends who are openly reaching out during this time, and knowing how important it is that we have these amazing tips that Dr. Zeiner's presented, but also the resources that we have. And so I think it's normalized the need for mental health and for mental illness concerns, substance use, and how they relate. And so it's brought it to the forefront and made it something more socially acceptable to discuss.
Fabulous.
Yes, that's wonderful. Yeah, I totally agree with all those. I think I'm gonna go from a perspective that might be a little bit more in terms of access, and I'm pleading for advocacy for this. Really, this is I'm calling for an action. Telemedicine. I am a huge advocate of telemedicine, and what that means is like a virtual visit like this. And I think that we saw the strength of it during the pandemic, and I think we need to keep leaning on it as a strength, especially for mental health. It is so easy to do these visits with technology, and we can see more people as providers, and we can see people who might not be close by. And access, I'm thinking of our rural family and friends who do not necessarily live close to a mental health provider, especially one that might be culturally congruent with us and that might understand our culture and our language. We now have access to them across the country, and we need to keep pushing for that, because I think current policy is that they are going to try to take some of it away, and we cannot have that taken away from us. I think COVID taught us how important it is for access. And I think during COVID, what else did it teach us? That we're all on this journey, and that, and I love what Ms. Padilla said in terms of like, it's okay to not be okay, and knowing what our triggers are and stepping away from them sometimes, and finding that line and making sure that our boundaries are understood. I think something that I saw out of the emergency department a lot is that anxiety and depression are actually very linked to pain, and it manifests. Anxiety and depression and mental health actually manifests in our bodies, and you don't know why you might have pain, and it's like, why am I in pain? It actually can be just related to your mental health. And so I saw a lot of that over the course of the last year, and it's so incredible sometimes that it's like, wow, I didn't know that my anxiety or my depression is actually causing this physical feature to happen. So we have to be careful about just treating the physical parts of us, because it's always not the problem, in making sure that we're addressing both the mental parts and the physical parts, because it all plays together, as Dr. Martínez and Ms. Padilla was saying. So those are my tips and thoughts about pandemic.
Wonderful, absolutely excellent insights from both of you. It really makes me think about another thing. I think the pandemic hopefully is making clear to folks, just like we have understood the difference between physical health and physical illness. It's mental health versus mental illness. They're not the same thing. Many of the tips they're giving is how to continue to maintain our good mental health so that we don't go down the road of it turning into a mental illness, an actual anxiety. So we're all dealing with stress, but there's other factors that could then tip us over into, and I loved that it was brought up that, we are all prone to this as human beings. Just because you're Latino doesn't mean you're going to be an anxious person. No. That's not the way it works. Thank goodness. But we're all under stress, and if other factors come into play, it could tip us into depression or anxiety, or even much worse, where we're actually thinking about maybe suicide. We want to be able to prevent that. So there's tips for mental health that I'm hearing about, but there's also tips being talked about if you're already dealing with. And I think it leads us to our next question. And I'll start with you, Dr. Zegers. So someone's asking, what tips do you have to suggest for individuals who are scared to receive help for their anxiety that has worsened during this pandemic?
Yeah, so I think acknowledging your fears is perfect. It is okay to be afraid. This is scary, especially when it's getting worse. It is scary. So owning that, and that's okay. But being clear about that. And when I work with patients and they come in and they're like, I'm afraid of this, I love it because that gives me a tool as a provider so that I know how we can work together on something and I know how we're feeling. Coming in and being stoic and strong, that is great. And I like to play into that as well. But also knowing what you're afraid of is so important. So expressing those fears and concerns. And also something that I've told this to my family as well, if you're not comfortable with a provider, find one that you are comfortable with. You don't have to stick with the same person that you've seen one time and you didn't have a good experience. There's many more out there. So make sure that I wouldn't recommend jumping all the time and going from one to the next for forever. But if you're not happy and you are too afraid to talk to your provider about it, maybe it's time to think about finding a provider that you are comfortable with. And you can find a male or a female, or if you can find a culturally congruent or Hispanic, or there's just ways to look at their profiles and even go online. Most providers now have their profiles online and where they're from and what they do and some of those other elements that are making it easier to find somebody who might match up with you. So don't hesitate to do that. Don't give up just because of one bad experience. That's one thing I do want to point out. And then if you're fearful, I think the other thing that I want to bring forward is that you're not alone, and fear is actually very common, and I would say more common than not. So know that you're not alone, and it's not something that providers are typically afraid to talk about. We just got to bring it up. And so I would say be courageous, do this for yourself. One of my pieces of tips I would love to say is if your sister or brother or mother were to ask you the same thing, what would you tell them to do? And tell yourself to do that same thing. We care for everyone else, but you got to care for yourself too. So definitely step up. You can do this, and I believe in you.
Excellent. Ms. Padilla, you have, I know, a unique perspectives as well on this. What do you recommend for the individual dealing with this kind of anxiety?
Yeah, I want to just echo everything Dr. Zegers said. I mean, it's incredible to know that, we're totally vibing on this. Very rarely do we have the opportunity to say that we can share an experience with a large percentage of the population. I mean, whenever, it's always so small. And so let that be the freedom for us to speak out and to reach out to access the care that we need. I absolutely love how you said that we advocate for our families and for our friends and those around us, because I never advocated for myself. I could stand on a mountaintop and scream for the needs of others, but I would sit quietly at home and deal with my own. And so same thing, just reaching out and knowing that this is the time, this is an opportunity, and there are resources available. They're being provided. You are not alone in this in any way whatsoever, and reaching out is the first step.
Absolutely. And I'll remind the audience of the many resources that Ms. Padilla had listed there. So there are ways to do it. As Dr. Zegers was saying, you can contact your provider, but if that's not your method, there's apps out there. There's telephone numbers you can get online. See if you can find a NAMI peer. just like Ms. Padilla, and chat with her and seek out their guidance and advice. Thank goodness there's so many ways now. But to your point, Ms. Padilla, you're right. I mean, for one of the first times in probably the world, we are all in the same boat. This pandemic, that's why it's called a pandemic. It's around the entire world. We are all human beings, and we are all experiencing the stress of this pandemic together. How it impacts us, though, is when it becomes kind of different, right? Because we're not cookie cutters either. We are individuals with our own lives, with our own families, with our own dynamics and our own factors and our own healthcare needs. And that's where we need to also have that nuance and person-centered approach, as I'd like to say. Let us thank Dr. Zegers and Ms. Padilla. You guys have been just absolutely awesome as subject matter experts. And I want to thank you so much for participating in this webinar. And I'm hoping that for our participants, you've been able to take a few pearls away. Let us not only thank our attendees, but our experts here for joining us for the virtual event. For more information about today's virtual event and our upcoming virtual events, please visit NHCOA's website and social media channels, Twitter, Facebook, and Instagram using @N, H, C, O, A, NHCOA. A recording of this town hall will be made available on our YouTube page. So remember that it is just as important, and it was brought up many times, to take care of your physical health as well as of your mental health. Follow the guidance of our mental health specialists here, please. Mental health should not be a taboo topic. That's been brought up multiple times as well. Please work on that. It should not be taboo. It's part of being a human being. And it is important to pay attention to so that we can achieve, all of us, our optimal state of health. So thank you, and until next time, adios. Goodbye, everybody.